for coming on the podcast.
Thank you for having me. It's been a long time coming. I'm excited.
Yeah, we've been planning this a while, haven't we? So it's good to finally do it. No, it's cool. So for people that are watching this for the first time, obviously just tell people a little bit briefly about your company, first of all.
My company is called Alex Aethetics. It focuses on anti-aging, rejuvenation and enhancement with natural but noticeable results using products such as hyaluronic acid, which more commonly known as dermal fillers, botulinum toxin, which most people know as Botox, and I also use some elements of what we call skin boosters, so things like Profilo and stuff like that.
Oh, brilliant. Well, I look forward to digging a little bit deeper with this and asking a bit about the business, etc. But let's go back to the beginning then. So this is the Benfleet Business Podcast. So you went to Dean School, did you say?
Yeah, so locally, my primary school was St Michael's, and then my senior school was the Dean's School. I think it's now a sports college or an academy, but just normal when I went there. But yeah, that was sort of, I grew up locally. My business is local. I have sort of moved away and come back, but sort of back from where I'm from, really.
Oh, fantastic. So when you was at school, did you sort of know what you wanted to do? Did you sort of fall into the industry? What was your sort of ambition?
I mean, when I was at school, I didn't really know what I was going to do at all. Actually, when I left school, I didn't do anything related to what I do now. I actually got accepted into the National Judo Academy. So I was quite talented in judo. I was a national champion. So I actually trained professionally through national lottery funding and private sponsorship for 8 years, taking me sort of around the UK and world, trying to ultimately, I'm sort of 35 now. So my ultimate aim at that time was the 2012 Olympic Games. Right. Two of my friends actually went and got a medal. So I was in good company, but sometimes in those sorts of elite sports environment, you put your body under a lot, and mine couldn't quite hold up to the demands that I asked of it. I had sort of 7 operations or something, knees, shoulders, nose, eyes, all sorts of things.
So what sort of college did you go to?
So I actually didn't go to college. I moved to Bath University to train full time. While I was there, I only had the qualifications that I did at school, and I was able, through a sports scholarship, to get onto a foundation degree in sports science. So that was kind of aimed at sort of A-level. So I did that. I completed the degree up in Leeds, and then I kind of wasn't sure what I wanted to do. I was quite bitter about the whole sports thing. I hadn't quite made it. I've been left with obviously some life-altering injuries, with the knees and stuff like that. And so my friend at the time was doing medicine, so he was trained to be a doctor, and I thought, oh, that sounds quite cool. And that was literally, it wasn't ever a lifelong ambition to go in and help sick people or anything. It was literally that sounds quite cool. It's very different to what I'm doing in sport, a little bit more selfless than I'm used to, whereas sport's very, it's all about me, it's what I'm eating, it's what I'm drinking, how I'm sleeping. So I actually went into, I did a 2-year master's in nursing. Yeah, and I worked on the wards for many years, and then I went and did what's called a new healthcare profession. I don't know if you've heard of it. It's called a associate physician or physician associate. So it's a little bit like a intermediary between a nurse and a doctor. So it's like, they call it associate doctor. So you're trained by doctors to think a little bit like a doctor. So in that role, I kind of worked in A&E and general practice. So I trained initially in facial aesthetics sort of 5 years ago now. And I didn't really do a lot of it because it was a very rushed sort of 1-day course. And, with these sorts of procedures, it can carry an element of risk. So I didn't actually really, I did friends and family and stuff, but I didn't really pick it up until about February 2020. And I went on a lot of, I sort of put it to the back burner for a number of years, and continued with my nursing, my physician associate, And then I picked it back up in February 2020, and I just loved it. I felt like it restored confidence in both myself as a patient and others as a treating clinician. So with it, at the time, we were just about to go, I believe, into a lockdown. I think the first one was March 2020, and just the pressures of the NHS and the pressure we were under was horrendous. And I just thought, do you know what? I don't want to do this forever. I've got a business that I enjoy and I love, and I'm really feeling like I'm getting. And I always joke to my patients, but it's not so much a joke. It's kind of reality that I actually felt like I did more good in the aesthetics field than I did in the GP. In the end, I felt like I was firefighting a lot. So that's sort of how I got started in that. Very little bit of a strange route from a professional athlete to a nurse, very male dominant to perhaps some might think as a little bit more female centered. And then obviously going into what some might call a cosmetic or beauty industry, although we do think it is, those that are medically qualified do think it is medicalized.
That's a great story, though, how you've kind of followed your passion at the end and you've discovered it yourself, that you realise it's what you wanted to do as time went on. So you said sort of 2020, that's when you kind of discovered it. I mean, was that when you sort of launched the business, or was it quite recently?
Yeah, so soon after I launched it, yeah. So I think about April or May. So, but at this time, it was quite an awkward time because we were in a national lockdown, and that was obviously the first one, which was the tightest, and we were a non-essential service. So really, I'd just done all this, paid all this money for training, and to not be able to use it how I wanted. So it was a bit frustrating, but I held on in there and just kept plugging away, seeing a few clients a week. And then where I put myself out there and I've applied for jobs and applied for opportunities in different salons, I've taken up some partnership deals with a few places. I've got bigger and got to a point really where I've been able to leave my job in the NHS completely. So I've been out of the NHS about 8 weeks now, which I don't know if I should say this, but I'm going to say it anyway. It's the happiest I've been for years, honestly. The pressure we were under in the NHS was just immense. And
well, full marks to you if you was involved, obviously working at the NHS over the last 18 months. I mean, it's unreal what everyone's been putting themselves through and doing for the country. So kudos to you, but also congratulations that you've been able to leave and, like I say, build your business. So obviously,
thank you.
8 weeks ago, you've done that. You're now sort of your own man. You're doing your business. So how did you start off? Sort of April 2020, you were saying. So how did you find clients? What was the process?
So actually, I pretty much I have mainly found all of my clients through Instagram, or they found me.
Okay.
I did in the beginning. It sounds really silly looking back, a couple of years into business, but I did. I literally just literally looked at friends lists of people who were following aesthetics accounts locally, like my competition almost, and I followed all of them. There wasn't any sort of great rationale in it or great, business, business sense. I literally just did that, and as I got my personality out there, because people buy from people.
100%.
A lot of people like that, and then you see that their friends follow you and stuff like that, and that's how I got a little bit bigger. So I initially, and still am, renting a salon locally in Benfleet. So I rent a room out, pay a fee when I have clients in. It's sort of it worked out quite well because it's a family friend, so we've got a good understanding there. And so basically I kept getting the clients from there. They would refer friends. I mean, I've never really had, I've never done SEO or Google stuff.
No.
I've had a few websites that have been a bit of a disaster. I don't know. I've commissioned a few people to do them, and hopefully now this is my third website that I'm on. I've got the right guy. It's going to have the right capabilities to do what it needs to do to build the business. So yeah, it's
it sounds like it's going well for you, and word of mouth is a big thing, and ultimately, like you say, using Instagram, social media. I think there's a lot of people that are going to be watching this that are business people, that are thinking of going self-employed. So like I say, we like to promote the guests that are on here like yourself, but we also like to give people advice as well if they want to launch their business. And whilst there's, depending on your industry, there's other things you've got to do like canvassing, etc., newspaper articles, but good old social media is the way forward, isn't it? I think it's
yeah. I have done a little bit in magazines and stuff, and I've found, and I've had this echoed from a few people as well, that that's not as successful as you would think. I'm not sure how many people flick through the newspapers these days and look for businesses that way. And it seems
return on investment is a lot lower now, isn't it? I'd say.
Yeah, it seems that if you've got a lot, it sounds crazy, really, because it shouldn't be a way that you actually pick a practitioner, but it seems that the amount of followers you have, who trusts you. So I managed to collaborate with a girl from Love Island and Towie. That just builds trust. The patients don't necessarily want to look like them. So in fact, I've got a friend that treats Chloe Sims, if you know her, and it builds trust with the clientele. But actually, the first thing they say to her when they walk in is, "Don't make me look like her." Which is, it's funny because the reason that they're there in her salon today is because of the trust that that having Chloe Sims as a client has built, but they don't want to look like her. It's quite a strange thing. The influencers don't really bring clients in, but they build this element of trust.
Yeah. And sometimes that's what it's all about. It's about personal brand, isn't it? And like you say, you don't they might not necessarily want to clone you, if you like, but they trust you, and it builds, it advertises itself, doesn't it? Which is the way forward. And it sounds like you're doing the right thing, which is really good.
Yeah.
So for people that are watching this that are interested, I mean, what's your sort of typical target audience? People that come to you, what's your typical client, should we say?
So my avatar that I've made is a lady called Debbie, and she's kind of 20s and 30s. She's maybe not looked after herself as well as she could. She's partied a lot. She's used sunbeds as a lot of people do. And suddenly she's sort of, and she's got a good job. She's got some disposable income, and she's looked in the mirror and thought, she wants to sort of invest in herself, because that's what I do. I want clients that are going to see me for the next 15 years, and we go through a journey, because everything I do, unfortunately, doesn't last. So, for example, Botox is 8 to 12 weeks, so it attaches to the receptor, and then it slowly but surely it sort of unattaches. And the same with fillers, the hyaluronic acid. We dissolve our own hyaluronic acid, so anything synthetic we put in, it dissolves as well. So that is sort of Debbie, this fictional avatar character who wants to invest in herself over a long period of time, and she likes quality. She wants to have that service to make her feel special. She wants perhaps a medical professional, because she values her safety more than she values the money that it would cost. So as you're probably aware, and I think we did discuss this previously, within this country, there are medical injectors and then there are non-medical injectors. So it seems, I'm not sure why, I don't really look into the why or the history of it, but for some reason Britain doesn't have this in law, that non-medical people can do that pretty much the same as me, really. And in some instances it's easier for them. So there's a procedure, I don't know if you've heard of it, called PDO threads, and it's basically surgical threads that you can put in someone's face for a lift. And if medical professionals do it, they have to be what's called CQC registered, so the same as your GP or dentist. But non-medical people can do it just in a normal salon.
So people in the industry, some people aren't qualified, they can just crack on with it.
Yeah,
obviously so I mean, be trained at what they're doing. But there's no kind of sort of qualification, if you like, to become a.
There's no standard. No, there's no sort of standardized. When we're talking qualification, whether that be a medical bachelor's, a bachelor's of science, like a doctor, or a BSc or MSc in nursing, there is no. You don't have to have that. They can have CPD accredited courses and gain insurance through that method. But no, you don't have to have a qualification to do it. And there is no, they are trying to bring in a level 7 qualification. And there is talk, you might have heard recently that Nadine Doris, I think her name is, she looks after wellbeing and health. They've now made it actually illegal for under 18s to have lip filler. Before it was legal, unethical, but legal.
Yeah. And you need those sort of rules, don't you? And to sort of keep everything disciplined, because people don't know what they want until they're probably 21, to be fair, let's be honest. But it's good to sort of know and have a direction with someone like yourself, because I'm sure you probably have clients that come to you and you probably talk them down occasionally. Have you ever had that? Where I know you're not there to give them complete advice, but do you sometimes look at a client and go, look, I'm sorry, but this is probably not the right thing for you?
Yeah, I mean, what we need to consider as health professionals is not just actually what the patient wants. We need to work together to become a collaborative care decision about what is the best treatment for them. And we have to consider their biopsychosocial. So not just if they'll get benefit out of it, but how they'll be perceived by the outside world. So I've got to think how somebody down the street will look at her and just say, oh, well, she had done, like in a negative way, rather than she looks fresh. So that's actually something that I have to consider as a healthcare professional. Am I sort of making her less able to communicate with the outside world, or the pack, if you like? So yeah, I mean, I have talked to people and say, you know, and they could, in the industry of medical professionals, they call it kind of breaking up with a patient, and there are different ways of doing it. And one of them, you know, is saying, you know, I'm not sure that I can I'm not confident I can meet your expectations or make you happy. And there are different ways of doing it, as there are in a lot of medical models, like breaking bad news and stuff like that. But yeah, it can be very, very difficult at times with the expectations of the patients versus what you're willing, able, and wanting to do for the patient.
Yeah, exactly. It's a fine line, isn't it? But on a different note, what are the risks involved, would you say, with obviously your clients?
So there are a number of things that can happen depending on if we're talking a toxin treatment or a fillers. So I suppose we could start with the toxin. So we believe it's a medical procedure. Botox itself is a prescription-only medicine, and so the risks of that can be, you know, bleeding or bruising. We try not to bruise anyone, but if you're using needles insertions in multiple places, it can get some bruising. Pain is not usually very painful. Infection, whenever we break the surface of the skin, there's a small chance of exposing it to the outside thing. The dermis, or the skin, keeps us safe from the outside world. It's very rare to get an infection, so we just ask people to not wear makeup for 24 hours, trying not to touch the area, and change their pillowcase at night, and that just reduces the risk. So Botox itself, actually, so it smooths out fine lines. So what can happen is it can drop here a little bit if you put in the wrong place or a too strong dose. Now, this muscle here you want to hit, which is the procerus. Under here is a muscle called the levator pupillae. So if you hit that by accident, this is the one that controls the lid of the eye, the eyelid. So it can make the eyelid droop. So that is obviously quite a serious complication. But there is an eye drop called apreconidine that you can drop in that contracts the Muller muscle and opens up the eye. So everything is treatable. And the third thing is, and I don't say it anymore because I treat a few 20-year-olds sometimes and they don't know who Mr. Spock is. But people sort of our age, you're like, of course you know who Mr. Spock is. But honestly, a lot of youngsters now, they don't. So that you can get the Spocky of the eye. And you've seen it probably with a few celebrities that have had Botox, like Wayne Rooney, Simon Cowell, John Travolta. There's been a few sort of celebrities that have had the Spock eye. That is quite easy to treat, actually. You just put a little bit of Botox here and here, and it brings it back down again. So that was sort of the things with Botox. But Botox is reversible.
I mean, is it one of those with Botox, for example, if you don't get it, because you say it lasts for 12 weeks, if you don't repeat it after 12 weeks, is there sort of a knock-on effect? Does it just go back to normal?
Yeah, I mean, it's a question that I get a lot. A lot of people are quite scared that if they suddenly stop treatment, they're going to fall off an aging cliff.
Right.
And you know, my sort of clinical experience and my what the literature seems to suggest is that you just go back to normal and continue aging normally, rather than you get much worse from it. You may feel like you're getting a little bit worse because actually you're used to looking a little bit fresher, the lines being nice and smooth. So obviously if you let that go, you might feel like a little bit, but the reality is you go back to pre-treated state and you continue to age normally.
Yeah, because I suppose as well there is a stigma in general, isn't there, behind treatment? People that come and get, you know, their lip fillers, etc. It doesn't necessarily get the right kind of promotion. People kind of look down at people for doing that. I mean, it is actually a positive thing at the same time. You know, what's your thoughts on that?
I feel that particularly a lot of boyfriends, husbands, they do have a real problem with it. And as someone in the industry who talks to women a lot every day, you begin to realize that actually they are very much doing it for themselves. It's to make you feel better, because there's nothing worse as a lady that you have small lips. And I'm not talking when people overdo it and they're augmenting the lips for the sake of augmenting the lips. I'm talking about genuinely someone who's lost volume in lips because of the aging process, which does happen, and actually they try and put lipstick on, it goes all over the subcutaneous there, and it's quite demoralizing for them. And actually somebody turned round to me before and said that having lip filler makes them feel sexy. It's all about them. And that was so much evidenced by the other day where a lady came to me with a hijab and she had a skin boosting treatment, and I thought, do you know what? That is for her, absolutely for her, because really a lot of most people out there are not going to see her face because most of it is covered. So that just shows that it's not for anybody else, it's for yourself. Listen, we have a responsibility to weed out people with genuine body dysmorphia and identify them and try and talk to them for the right channels through the GP and psychological service. But for people that don't have this can be a massive positive for your mental health and your well-being. It really can. And people, I don't think they're too quick to judge, and there is a stigma behind it. But actually, it's quite funny because a lot of the celebrities that you think, wow, they're hot, you know, they look very natural. You know, are you telling me J-Lo at 50 looks like that from olive oil? It just doesn't happen, which is what she claims, by the way, why she looks that good at 50. And a lot of the celebrities that we look at and we think are really natural really just have really good work done.
Yeah.
So what our perception of beautiful is very, very geared towards possibly cosmetic procedures. But then when people we know are having them, it's very stigmatized. There is an element of male protectiveness over them as well, because if you do get a bruise, you feel like it's an injury. So, you've injured my wife, girlfriend, sister. Actually, a bruise, really, if we break it down, you've just put a needle into a little blood vessel and it's leaked. Yeah. And it looks worse. It's like a tinge effect on the outside.
It needs to heal, doesn't it? At the end of the day, it's just. But the main thing is like you say, it's like anything. Everything's good in moderation. You know, it's just some people obviously take it to the extreme, and I think that's what kind of gets put on the media, puts on the telly in terms of cosmetics gone wrong. You know, but it can work if it's treated in the right way. Definitely.
Yeah, and you know, a lot of people, you walk past down the street, you never realise they had anything done unless you knew. So it is something that can be very natural, very noticeable, which is what I'm about, really. Not overdoing things. And you know, I would like to say that a lot of the people taking this too far are from a non-medical background, but actually we know that there are medical people doing this as well. You only have to look at someone like Michael Jackson, you know, and his multiple nose surgeries and other features to know that these are probably top plastic surgeons in the US that are doing that. So if you go to enough people, you will get what you want. So it's about the morals, setting your own boundaries and morals and trying to adhere to them, really.
Definitely a bit of a cliche question, I suppose. Are males, you get a lot of male clients now that are getting treatment?
I think more so than previously. So I still think there is a massive divide. So there's more females than males having it, probably about 80 to 20. It's still very much female dominated, but there are men that actually they just want a really nice jawline. It's very masculine and very attractive to be angled. So you think of what it's funny, but attractive males are based on people like Batman, Johnny Bravo. You think of those angles, and a lot of males desire that, especially if they have softer complexion, rounded faces instead of squared. And so a lot of them will come for the jawline. Some of the males now really do not like the heavy lines that some males get across here, so they do come for Botox. Some males have even come for lips, because all of us as males will lose volume in our lips, and females as we get older. So yeah, it's just about it's still about 80-20. There's not as many, but it's definitely increasing to what it used to be, because males are much more image conscious now.
No, that's a good point, really. But in terms of the industry as a whole, what's your sort of philosophy? What's your sort of views on it in general?
Well, I mean, you have to kind of pick where you want to be in the industry. The industry can be a little bit of the Wild West, but I try and place myself in with mostly medical professionals. And so you've got clear ethics and a clear guidelines about how we should act and what we should be doing for our patients. So, and I surround myself with positivity. There is a lot of negativity and stigma within the industry itself. So I try and, as long as I'm with my professional colleagues, and because it is almost a sole trader industry, you work pretty much by yourself unless you're established clinic where you have your team with you. I just try and surround myself with positivity, and it really reflects well, and you get a lot of great support.
Oh, fantastic. But on a different note, I'll mention in terms of how people can contact you if they're interested, but people that are looking to launch their own business like you're doing in any profession, what's your advice to future entrepreneurs, if you like?
Wow. I'd say do it slowly. I think sometimes upping and quitting your job and making a business is not the best way to do it. At times it will be hard, because you will be working 70, 80, 90-hour weeks trying to do your full-time job and then build the business on top of that. So it's hard, but it will be worth it. So it's just starting slowly. I wouldn't recommend, although I'm not an expert, and I'm sure some people have succeeded by doing this, throwing all your eggs in one basket, investing all your savings into this business. Just start slowly and try and do it from home or something like that, and then build up. That's what I did. I mean, I was still working full-time for the NHS and seeing people at weekends. And then as I got busier, I was able to open up a day in the week, go part-time in the NHS. And as I got more opportunities to work with different salons and increasing client base, I was able to say, although even still a bit risky and probably making slightly less than I did in the NHS, I thought, right, I'm out. And so at the time I was locuming, so I didn't have to give any notice. So I just one day said, I won't be returning for any more shifts. And that was it. So definitely the advice is to start slowly. I would say invest more in your marketing and your brand than I did. I think my brand is quite poor. My brand is just me, which can be a very strong thing in a sense, but I haven't built a brand, colours, websites, and I think I invested a lot more in my training. So I probably, in the last 2-3 years, invested sort of 10, 15 grand just on training, maybe
Wow.
more. And looking back, I think, okay, I've got a lot of skills now, but actually it's no good being the most skillful practitioner in the world if no one knows who you are.
Exactly.
So I think if I had my time again, I would probably still do the courses, because I am as good as I am today because of the courses, but I'd probably invest a little bit more on the marketing and building a brand that people recognize. And there are specialist people that do that.
Brilliant advice. No, I really appreciate that. So if people want to get in contact with you, how do they do that?
So I'm on Instagram under Alex_Aethetics. Or, we can put my mobile as well under, and that comes obviously directly to me. The good thing about being sort of a 1 or 2 man business is you do most of the things. So when you text or ring me, it's me answering. So when it starts getting big, you don't know who's answering. So as someone that's still got a small business, you'll be in contact with me. We'll be able to get advice sort of 1-to-1, and then we'll be able to point you in the right direction and do a consultation, hopefully.
Sounds amazing. But Alex, thank you again for coming on this podcast.
Yeah, great. Thank you.
And I wish you all the best.
Oh, thank you very much. Cheers.